Hey everybody, we're live today. I'm Dr. Maggie Yu, an integrative physician, and we have an online program, Transform Autoimmune Disease Naturally. And today we are on the hot topic of what is the connection between autoimmune and your freaking hormones. And according to the conventional world, there really is no connection. So we're here to bust that myth to the bone with one of my favorite people on the planet. I'd love to introduce Dr. Carrie Jones. Dr. Carrie Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health and hormones. She graduated from the National University of Natural Medicine, School of Naturopathic Medicine in Portland, Oregon, where she completed a 2-year residency additionally in women's health, hormones, and endocrinology. Later, she graduated from Grand Canyon University, Master's in Public Health program, and a goal of doing more international education. She has taught gynecology, advanced endocrine fertility to medical students, and has been medical director for 2 large integrative clinics in Portland. She is currently the medical director of Precision Analytics, and who are the creators of the Dutch hormone test. So we're here today, and we're going to talk about hormones. We're going to bust myths. Carrie, say hi.
Oh my gosh, I'm so excited. How are you?
I'm doing great. So for those of you that are watching right now, if anybody that you know has hormone issues and autoimmune disease, please share this right now to your page or type their name in the comment section so they get tagged right away and watch this, okay? And people are starting to come in. So what I want to do is give us a heart, give us a thumbs up already right now. If you have burning questions about your hormones and how it's linked with autoimmune, anything at all, go ahead and post in our comment section. We take these questions very seriously. We're going to be here as long as I see some questions, we're going to be answering them. So without further ado, I'm going to go back down memory lane and talk about how Dr. Carrie Jones and I go way back.
Way back.
Way back. So remember when she said that she was medical director of some large integrated clinics in Portland, she was actually the naturopathic medical director at our integrative clinic for about 4 years. So we go way back. We met, how many years ago was it, Carrie?
Oh my gosh. I want to say 11, 12. No, I don't know. Years, 10. I just like,
it's been 10.
Yeah, I was going to say 10. Yeah.
So, I mean, this is, I think a little bit down memory lane is great because I think it frames this conversation really well. I mean, my story is that I was a conventional MD, family medicine doctor, graduated out of UCLA, worked with some of the largest medical groups, and I came down with early menopause at the age of 36, no clue why. Doctors told me that I was just getting older and I felt like crap and my whole life was falling apart. And I eventually ended up opening up my own clinic and an integrative clinic. And I really felt that and learned a lot about hormones, that balancing hormones was actually a huge part of what was starting to get me to feel better. And once I recognized that balancing hormones was key to me feeling better, I started to recognize that that wasn't the whole picture, that there were other pieces to this that was not, that I could help people to some degree, a huge degree with balancing hormones, but there was a huge issue underlying with autoimmunity that I was absolutely missing as a conventionally trained MD. And this is where I started to interview naturopathic physicians because heck, they know more about hormones than us MDs do, period. I knew that because we shared a lot of patients. Carrie and I actually shared a lot of patients in Portland, Oregon, and Carrie called and introduced herself. And everybody was like, Carrie's great on hormones. Carrie's great on hormones. I'm like, I'd like to see this woman for my hormones. Carrie, and then that's how we met was you actually came to my clinic and we talked about how we could collaborate on some of these mutual patients.
Yep, absolutely. Yeah. In fact, when I got there and we were talking, we went over the lab results of a patient. I mean, again, this was years ago. This was in the beginning of your quest to getting into integrative and functional medicine. And you were flipping through lab results with me and you were like, well, her TPO, her thyroid peroxidase is high. And you go, well, whatever that means. And I was like, whatever that means she has Hashimoto's. And that sparked the entire journey of, I need to know what that is on your part. I need to know what that is. I don't understand. You mean like there's more than just medication? And I said, oh my gosh, yes, let's embark.
You literally blew my mind that day because you're obviously we're just gonna have a conversation about my hormones, or a mutual patient we're sharing their hormones. And then you point out to me, hey, this is an autoimmune issue, and I had no idea. Literally, as an MD training at UCLA, 10 years in practice at this point, I had very little idea of what it means to have autoimmune disease, or that it was even related to the hormones.
Right. Right. Yeah. Which so many MDs, so many practitioners in general, not even just MDs, DOs, nurse practitioners, PAs, they don't get taught that. And so they just don't know it.
I will absolutely say that 80-90% of everything that I learned about hormones, I learned from you.
That's really generous. Thank you.
Because I mean, literally, I literally basically gave you a job offer on the spot and said, we'll be the naturopathic medical director at this clinic. This clinic we grew to 6 providers over the following 8 years.
Yeah.
I mean, it was the largest integrated clinic in Portland for quite a long time that actually had MDs and conventional medical providers working with naturopathic providers.
Right. Yep. And the great thing is, which we were talking before off camera, was that how well everybody communicated and helped each other. I learned so much about primary care from you and the other practitioners, are just things that, I don't get taught as a naturopathic doctor, and vice versa. So many of you and so many other conventionally trained practitioners were like, oh my gosh, now I fully believe in food intolerance testing or food elimination or autoimmune or gut health because of what I'm learning from the naturopathic doctors.
Yeah, I mean, I absolutely agree. And the thing was, the proof was in the pudding, because I will say, do you guys know who diagnosed me with having Hashimoto's? I was balancing my hormones, taking, and I was feeling like maybe 50% better. And then we had this TPO conversation about Hashimoto's, and I never understood the link between Hashimoto's or thyroid problems with hormones.
Right.
So we ended up testing me, and you're the doctor responsible for actually diagnosing me finally after 10 years as having Hashimoto's and an autoimmune disorder.
Yeah. Yeah. And look at you now, teaching thousands of people all about it moving forward. I mean, it's incredible. I love it.
I love to learn, and I love, and you're an incredible teacher. So what I want to do is without further ado, I want to go in and dive into some of these questions, because you have this really unique knack of making really complex biochemical pathways. You're such a biochemistry nerd, man. You have such a way of simplifying it to almost stupidly simple, so that lay people and conventionally trained doctors can learn from you with it. So without further ado, I'm going to ask, I'm going to start with the question, which is, how the hell is Hashimoto's, which is an autoimmune disease of the thyroid, linked with your ovarian hormones? Why do all these Hashimoto's and autoimmune patients have a shit ton of hormone problems?
And not even just our ovarian hormones, the cortisol. A ton of them have a ton of cortisol issues. So I'm actually going to back up and start there, because I think that's so important for people to learn. So we have this response in the morning. It's called a cortisol awakening response. It's a natural response. It's not a stress response. Your cortisol is supposed to go up in the morning to get your butt out of bed. But one of the things it does, besides help you with energy, give you alertness, help with blood sugar, lower inflammation, is it actually helps lower your autoimmune risk. And so think of the people who are listening, who are like, well, I really struggle in the morning. I can't get out of bed. I need a lot of caffeine. I'm super tired. I hit the snooze several times. What that means is your cortisol is not getting the healthy spike you're supposed to get. So what happens is, and I'll make this really simple, your body, your immune system makes all these immune cells, and your body is smart. It checks them to make sure they weren't accidentally created autoimmune. And it does it in the thymus gland, not thyroid, but thymus. And so when your thymus gland finds a cell that's naughty, let's pretend it checks somebody and it's like, are you autoimmune? No. Are you autoimmune? No. Are you autoimmune? Oh, yep, you're Hashimoto's. It gets pulled to the side to get destroyed because your body doesn't want it circulating. What helps trigger that destruction is that rise in cortisol in the morning. And so if you don't get the rise, a normal rise, you're tired, you need lots of caffeine, you struggle to get out of bed, you may also struggle with all your autoimmune, or you may struggle to develop additional autoimmune because they're not getting killed. And what happens is those little sneaky bastard cells slip out of the thymus gland, and now they go out in circulation. And just by addressing cortisol, it can really affect people's autoimmune.
I love how you call them sneaky bastard cells.
Well, they are. They're autoimmune, and they slip out. So there's a super fancy name for it, but that's essentially what happens. And I have found over and over as I'm teaching about this, that when people get their cortisol dialed in the morning, naturally, in a healthy way, that they're like, oh my gosh, my immune system, my autoimmune symptoms are so much better in the morning, or they're gone, or, you know, whatever. It's really incredible. And that's just one hormone. There's, as you know, there's several.
Well, that's a great question. I have Patricia Rosa Roach, who's joining us. Thank you for watching. She has a question. Sunita is also joining us with a question. Those of you who are watching right now, please write in the comment section where you're watching from. That'd be great, so we know you're here. Thank you so much. And Patricia has a question that we're going to get to in a second, which is, how does estrogen dominance play in autoimmunity?
Yeah.
And that is such a huge question.
Yes, absolutely. And really, you know, there's a lot of different theories as to why women are more prone to autoimmune than men. In fact, I was just reading a theory that came out the other day about how the body historically has been trained to dial down the immune system, because in theory, we're supposed to be pregnant like a lot. But now with the invention of birth control or fertility awareness, you know, women don't want to get pregnant. They don't want to have 8, 10, 12 babies. They want either none, or eventually one, or maybe 1 or 2 or 3. So this theory was saying that because the body maybe was designed to have a dialed back immune system, but we're not getting pregnant over and over and over and over again, now the immune system is ramping up. And so as our cycles go up and down, and we get this up-down shift of estrogen, progesterone, it's affecting our immune system because it's the in and out of estrogen, progesterone all the time. And as a result, we have this immune system that gets a little aggressive. It gets a little naughty, and now women are more prone to autoimmune. And I thought that was a really interesting theory, because I could see where this is coming from, is women don't get pregnant, choose not to get pregnant. They don't want 12 kids. And the immune system's like, oh, I can overreact. I can come at you, but it does it in a wrong way.
So this is why, I mean, I think this is a great conversation that's also sparked. Why is it that I call them hormonally vulnerable times?
Yes.
Why is it that when a woman has a certain cycling in certain times of the month, are her autoimmune system, why are joint pain, swelling, or mood way worse,
Right.
or energy or fatigue or brain fog? Right?
Right.
Why are some of these autoimmune disease symptoms way worse around certain times of the month? And the other thing is, why postpartum? Why when someone delivers a baby, when their hormones plummet? Why is that trigger? That's the most vulnerable time to trigger
The most. Yep.
disorder.
And it's all immune system related. It's all estrogen's effect on the immune system that does that. So if you have too much estrogen, like as an example, too much estrogen can increase our histamine. Histamine is a chemical that's released out of our mast cells in our immune system, and can create sort of all sorts of chaos and symptoms. And then that further increases or ramps up or irritates the immune system, and now we're at risk. On the flip side, really low levels of hormones also puts us at risk, because we need estrogen to like protect our brain, protect our bones, protect our skin, protect our joints. And we're postpartum, so we've delivered a baby. They go from really high to really low, and because we don't get that protection for a while, our immune system is like, woohoo, the baby's gone. I'm not turned off anymore. There's no hormone, and it goes crazy. And you hear of women all the time saying, I got postpartum thyroiditis, or I got postpartum, right? Exactly. Like, you know, whatever they developed. And it's because they're missing that key piece. So estrogen's definitely like Goldilocks. Like too much is a problem, too little is a problem. She needs to be just right.
But it's this whole question about women have way more hormonally vulnerable times because of menstruation and because of childbirth and perimenopause, postmenopause. The big swings in these hormones really makes it's clear that they trigger the onset of autoimmune symptoms. And that's why the majority of people who suffer from autoimmune disease are women, and frequently their symptoms can be started during those vulnerable times.
And then you add on extra load. So then you add on top of it, you're eating gluten all the time, or you add onto it, your insulin and blood sugar are swinging back and forth. You're hypoglycemic, or you add on chemicals, right? You add on the fact that you have a lot of plastics, and you use air freshener in your house, and you have air freshener in your car, and you know, your makeup is full of chemicals. So you have this extra load, and then you go through puberty, or then you go through perimenopause, or then you're postpartum. It's just, men don't have that cycle, so their load they can handle is much higher than the female load because we cycle. I mean, it's amazing that we can, you know, get pregnant, have babies, bleed and not die, like it's amazing. We could bleed every month and not die, but it just puts us at more vulnerability to these, to our immune system going haywire.
I agree with you. And for me, like I was the poster child of this happening because I had severe postpartum depression with the birth of both my children.
Yeah.
I went into an age 36, early menopause. I mean, how many of you out there watching right now are being diagnosed with really crazy, erratic, heavy bleeding that no one knows why, and you also have an autoimmune disease? How many of you out there have been told that you're going through early menopause and just getting older, and let's just put you on the pill?
Right. Exactly.
I mean, how much of this is happening out there?
I remember when you and I were talking and I was going over your lab results, and I'm only saying it because you just said it. And I said, did you have postpartum depression? You said, yes, severe. How did you know that? I said, well, your estrogen's really low, and it's really common when women give birth, you need estrogen to make serotonin, and serotonin is one of our brain hormones that's really helpful, we think, for happiness, and it's antidepressant, right? It's what all the antidepressant medications are based off of. Estrogen is what stimulates the production of tryptophan into 5-HTP that then goes on to make serotonin. So if you're a female with low estrogen, your risk for depression potentially goes up because you're missing estrogen. Postpartum is a good example. Menopause is a good example. Women go into menopause and they're like, I am more depressed. My moods are worse. What is this about? Like, I know you're losing the hormones. Yes, they're in circulation, but they're in your brain too. And they absolutely affect your neurotransmitters in your brain.
Okay, so here's the big thing. I mean, conventional docs out there, and I even see, even functional docs, there's this huge connection between your thyroid, your ovarian hormones, your adrenals, and your brain neurotransmitters. They're all connected.
Yep. You cannot silo them, which is common, right? People are like, oh, I'm only a thyroid doctor, or I'm only in conventional medicine, right? I only treat the thyroid. Or you go to your OBGYN for anything ovarian, right? You go to an endocrinologist for anything thyroid. It's like, no. The whole system works together. You have to look at it as a big piece.
So I have a lot of people joining us. We have Karen Sohn, who's joining us on our Facebook page. In our Facebook group, we're starting to have questions popping in. So all of you, please say where you're watching from. That's great. Thank you. And Cindy is joining us as well. A lot of people are joining us. This is, so Sunita has a question.
Yes.
$1 million question. It's a $1 million question.
Oh no.
What is the best way to test and balance hormones naturally? Let's just go with testing.
Let's just go with testing. Yes.
What is the best way to test for hormones? And is there a best way, Dr. Jones?
No, there is not a best way. And I say that fully working for a hormone company. I love my hormone company, but I know it depends on the person and what you're looking for. So just for people who don't know, there's 3 main ways. You test it in the blood, you can test them in saliva, and you can test them in urine. And it depends what you're looking for. It depends if you're on hormone replacement therapy or not, what you would choose. So for example, you get checked in the blood, and the blood is only going to tell you what your main hormones, estradiol, progesterone, testosterone, right there in the moment. But you don't want to check cortisol in your blood because you won't get any kind of rhythm. You won't get any kind of like up-down pattern. And what's happening in the blood is you can't tell the difference between what's free and active and what's bound up. So it's not really helpful. In saliva, really good for cortisol. You get the pattern throughout the day. You do get hormones, estradiol, progesterone, testosterone, easy collection, but you don't get the metabolites, which are the pathways. So now a lot of people, which is what I was using before I started working for the company, using with you at the clinic, was urine. And the reason I liked urine is, again, it's easy collection because it's spot collecting throughout the day. But you get the pathways. So you make an estradiol, an estrogen. Where does it go? Does it go down a cancerous pathway? Does it go down the less cancerous pathway? How's your detox? Your testosterone. Are you getting acne because you make too much testosterone or because your testosterone is going down the acne pathway? And that's why I like the urine, because you get these pathways. Are any of the testing wrong? Not necessarily, no. It just depends what you're looking for, how much in-depth information you need, if you're on hormone replacement therapy, that kind of stuff. So
I agree with you. People tell me what is the best way to test hormones, and I tell them there really is no best way. And part of it, sometimes getting a very elaborate test can be confusing as heck, especially if you're working with a provider who's not experienced.
Right. Which happens all the time, unfortunately, right? People will order online, or because there's now a lot of labs that allow you as a person just to order. There's a lot of walk-in labs. There's a lot of just patient-directed labs. So people will get excited. They'll order all this lab work. They have all this data and they freak out. Understandably, you've got to work with somebody who can pull the data together and correlate it to you and personalize it to you.
I agree. And for me, like the data piece is so important. This is why in our program, I tell people transform autoimmune disease naturally. It's not a program where I feel your woo-woo and you take my subscription to supplements for the rest of your life. Hail no, hail to the no.
Right.
And this is data-driven approach to how to turn around your autoimmune disease naturally. And I love that you're a naturopathic physician. A lot of people think it's all supplements and woo-woo. And we talk about, remember elevation? You're going to teach me how
to
elevate.
Yes.
Levitate.
Levitation. Yeah, it was written about me in an article that, or not me, but about naturopathic doctors, that we learn levitation. And I was like, if I knew how to levitate, girl, I would teach you. I would teach the masses if we could learn levitation.
We never actually taught people how to levitate, but you did teach me a hell of a lot about hormones. And it's a huge part of our program is actually testing these hormones. But here's a big cincher is that doctors out there don't understand what to do with these results, how to test or what to do with the results. How are patients who are ordering these tests on their own or never getting it done supposed to deal with this?
Right, exactly. It's hard. And so that's why it's, for example, like finding a good practitioner. So finding, for example, I mean, I work for the Dutch test. We have a list of practitioners that we can help direct you, right? Like you going through Maggie's program, like signing up for the program, doing it because you know you're going to get quality care. Looking up functional medicine practitioners, reading the reviews, asking your friends, reading the reviews. You really have to put some effort into it. Because not everybody's going to know.
Well, in fact, Terry, how many times do we have we seen people come from other doctors who are supposed to be hormone experts and we test their hormones and we're looking at it and we're like, this is like totally the wrong thing to do, or even looking at the same results we're looking at.
Right, exactly.
Come in bringing results to us and we're looking and we're like, why would this person put this person on estrogen?
Right.
No idea why, right?
Or even simple like testing, when to test, making sure, like women, ladies, if you do cycle, if you have a regular period and you're looking to test estrogen, progesterone, you test it in the second half of your cycle. You test it after ovulation. You test it around days 19, 20, 21 of a 28-day cycle. It's really, and I say this all the time as a half joking. I'm like, women will come in and they'll say to me, I got my hormones checked. And I'm like, oh, what day of your cycle? And they'll go, I don't know. It's Tuesday at 1. I'm like, no, like what day of your cycle? And they're like, I don't know. I was at my gynecologist and they just ran the test.
Okay. So which is why for me, it's a requirement. When you freaking have autoimmune disease, it's a requirement. You have to get your hormones and your adrenals tested minimally.
Yeah.
And there's tons of other things we test in the program. I have alumni watching right now. Rita Bradley's joining us. Marcy Weaver. Hi to all our alumni who are watching. Please say you're alumni. And those of you who have gotten your hormones tested in our program and the education behind what it means.
Right.
Can you please let people know what your experience was in our program, getting your hormones and adrenals mastered as part of your autoimmune disease treatment plan?
Yeah.
So, we got other people with questions, tons of questions coming in. Suzanne
Love it.
Goulette, those of you, please post your questions and where you're watching from. Suzanne Goulette wants to know, how does estrogen replacement affect autoimmunity? I love talking about this Goldilocks thing.
That is a really interesting question. So it depends. If you are low in estrogen and your estrogen detoxification pathways are working, then usually estrogen is quite helpful, I have found. And correct me if you disagree with me, Maggie, but I have found estrogen replacement can actually be quite helpful. But if your gut is a mess, if your absorption is a mess, if your detoxification processes is a mess, and then you go on estrogen, you may find that it makes your autoimmune significantly worse. And so this is why testing can be really helpful to know if you should go on it or not, and maybe somewhat predictable of if you're going to feel worse or not. Yeah.
I totally agree. And this whole gut connection is like literally the Holy Grail in hormone balance that doctors don't get. I mean, how many people just prescribe hormones for people? First of all, how many people don't test hormones and just prescribe or refuse to prescribe hormones?
Right.
How many people just give supplement for hormones? And the truth is that you need the data, but you need, and you need to know, like, why is this a problem anyway? And what's the connection with the gut? So let's answer this question once and for all. What is the connect? Let's just go with estrogen. What is the big deal with the gut and estrogen?
I know. Well, and we were talking about this before off camera. So and I mentioned earlier, estrogen goes through detoxification pathways. So you have you have 3 phases, phase 1, phase 2, and phase 3. My analogy is always the same. Think of a bathtub. So phase 1 is the water coming into your bathtub. Phase 2 is your drain, getting it out of the bathtub. Phase 3 is your sewer line, get it out of your house. In your body, phase 1 and 2 happen in your liver. That's your water and your drain. Phase 3 happens in your intestines. That's your sewer line. Basically, do you poop it out appropriately? So what's the connection with the gut? If your sewer line is backed up, then it's just going to back up into your house and back up into your system, right? And recirculate. Same in your body. If you are having intestinal issues, gut issues, bacterial, candida, SIBO, small intestinal bacterial overgrowth, you've got a lot of inflammation in the gut, then you have a backup in your sewer line, and your estrogen is going to not get pooped out. It's going to get recirculated, and now you're going to have all these estrogen dominant type symptoms.
Totally agree. Our colleague, Jolene Brighton, love Jolene.
Yes.
One of the things that she always says that I love, she goes, you cannot balance your estrogen or your hormones if you don't poop.
Yeah, 100% agree. Amen to that.
Yes.
Yeah, because think about it. If you have constipation, you don't go every day. Maybe you go every couple of days, or maybe you go every day, but you have a lot going on in your intestines, a lot of inflammation. Then your estrogen just goes, oh, I'll just recirculate. Like it gets set free from, it's supposed to be pushed out and it's not. And it just goes, it gets reabsorbed right back into your bloodstream.
So this is why for me, like, it's kind of useless sometimes that people I think that people look for Band-Aids and medication, but people also look for Band-Aids in the natural world with supplement. Is there a magic supplement? Is there one magic test? And there isn't. Like, how can you freaking balance hormones without getting the numbers, the education in yourself, and also working on your gut? And working on your gut has to identify what are the issues in food that's causing this problem in your gut with the absorption and your liver. The food really matters.
Yeah, absolutely. And even just from an autoimmune, I mean, there's the molecular mimicry theory out there that Dr. Karazian puts out, and Dr. Vojdani, where if you eat a food, and when you eat a food and you chew it up, it's supposed to break down into single or double amino acids. So that's 1 or 2 linked together, right? But if you don't chew your food very well, you don't have very good enzymes in your stomach and out of your pancreas. Now what happens is you get these chains of food. So instead of being 1 or 2, maybe it's 10 or 12, and that's not supposed to happen. So the body freaks out, and if any part of that big chain looks like a piece of your body, like we're picking on the thyroid, so let's say the thyroid gland, then that food gets tagged as bad because it's like, oh, that looks like thyroid, that's bad. And so now every time you eat that food and it comes through your system, it's what's called molecular mimicry. It looks close enough to the thyroid, so it gets attacked. And now every time you eat the food, it increases your risk for autoimmune against that tissue or gland or whatever it is. Well, and so it's like you were saying, if you can address your foods, it'll help.
Well, that's the other thing is people don't understand about leaky gut is when, everyone thinks everything is leaky gut. Not everybody has leaky gut, but some people do. But one of the biggest problems with leaky gut is that when the tight gap junctions are disrupted, a lot of these antigens from the food that don't belong in the bloodstream get presented in the bloodstream, triggering allergic and autoimmune attack.
Yep, absolutely. Absolutely.
And this is the whole molecular mimicry thing. But what I found is when we identify through data what foods are actually triggering it, and you actually heal and seal the gut, then you actually lower and lower and lower reactivity to a lot of these foods. And they're not all real problems for the rest of your life.
Yep. Totally. And for people who are listening, don't know, which she's talking about, the tight junctions, think of like your house and your neighbor's house, and the gate in between your fence and your fence line and your gate, that's your tight junction. So if your fence is weak and it's falling down and there's holes in it, like robbers and bad people can slip through. Your dog can jump out, right? Your kid can just walk through. And now they get into places that they shouldn't, because the fence with the gate is meant to be tightly controlled. The gate is to open and close to only allow certain things through. Your intestines is the same thing. Your house and your neighbor's house are your intestinal cells, your fence and your gate are your tight junctions, and they should be tight and they should be closed only to certain things. But if it's not, if it's falling apart, if it's, inflamed, if it's got holes in it, then whoop, everything slips through. Robbers come in, dogs go out. It's chaos.
I love your analogies because they make it so simple.
I know.
We have so many people joining us right now, and we have all these
Yay.
questions coming in. Please keep posting your questions and tell us where you're watching from. We got Elizabeth Liz from our Facebook group, and Elizabeth wants to know is, how do you stop all this? Because I see the hormone connection. I'm celiac and super sensitive to hormones and thyroid meds. It sends my body into AFib, even though I have no heart problems. I'm at a loss.
On how to stop the hormone issues. Is that what she was talking about?
She's saying that she's celiac and she has hormone issues, and she noticed that the hormone connection causes her to go into AFib. There's like a heart connection. There's a heart thyroid hormone connection.
Absolutely. There's a huge heart connection. Estrogen, tachycardia, racing heart is a big symptom, believe it or not, of low estrogen. A lot of women go into menopause, and because of that change in estrogen, they start complaining of heart symptoms because of the loss of estrogen. And so what I tell people is, just like you said earlier, there's no magic cure. There's no magic pill. We trust us. If we knew the magic, we would just tell you. We would just give it to you and tell you what it is. It takes work and guidance. It takes work and guidance.
Well, that's why I tell people that our program is like the whole meal deal, which is like, I mean, you and I've been treating and dealing with autoimmune disease most of our career.
Right.
And how many times do people come in, they think they just need the hormones done. And then we are spending so much time educating them. And hey, here's your blood sugar. Here's your food intolerance. Here are these vitamins. Here's, your brain neurotransmitters. And we're educating people one at a time, little piecemeal at a time. And that was really challenging from a clinical standpoint. Yeah. Which is why for me, the whole meal deal in a program that does this all in 2 months is huge.
Yeah. And so educational, so empowering, right? People can watch, listen, take the information and be very empowered, which I love.
I love it. Karen Sohn has a question. What's the typical cost to do these tests, and do health insurance generally cover it, or is it out of pocket? So cost of testing is the question. Right.
And I guess it would depend on the testing, and it depends if you're part of the program or not. Right. So it's all very variable, but as far as insurance covering it, again, it depends. Like a lot of the blood work, you can, if you're in or out of network, if you're in network, it could be covered short of your deductible and copay. Out of network, you have to apply to your out of network benefits. Some of these extra tests, like urine testing, saliva testing, stool testing, maybe can be submitted to insurance. It depends on the company. A lot of them can be submitted to your HSA or FSA if you have one. So it really, unfortunately, just depends on the company and what you're having run.
And that's the unfortunate thing is that so many people say that because the insurance company won't pay for it, they just won't get the test.
Right.
And to me, that's ridiculous.
Right.
This is your quality of life. This is your children's quality of life. This is your autoimmune disease, and is one of the biggest trigger of autoimmune attack. Right. So, which is why, and what's the cost of staying sick?
Right. Way more exponential than the cost of the test.
Absolutely. So
right. Think of the long-term sequelae. Yeah.
Absolutely. Even if insurance doesn't cover it, man, you got to do these tests. You got to educate yourself. You got to turn this around, because the cost of staying sick literally is 10 to 100 times more.
Yeah. Yeah.
We got a lot of men here.
Yay! I know, and the men always get forgotten. I'm like, no, don't forget the men.
Okay, so all the men watching, please right now tell me, I'm a guy and where you're watching from, because here's the deal. There's enough of you that says, I'm a dude, I'm watching, I'm interested in hormones and autoimmunity. I will do a whole other show on this.
Yeah.
Please give us a thumbs up, wow face. Dudes, chime in right now, okay? So we got some dudes that are asking questions on what is the role of male hormones? We don't have menstruation. We don't give birth. We don't have menopause. So how do male hormones even matter in autoimmunity?
It's very similar into their effect on the immune system. It's just not because women have so many up down and we have so many transitions. That's why we get it so much more prevalently. But men, absolutely. You are still just as affected by that cortisol awakening response. You are still just affected by your gut health, your tight junctions falling apart, the foods that you eat. You are still just as affected by the chemicals in your environment, the things, on your food, your plastic water bottle, the air freshener in your car. You are still just as affected. And absolutely, men is when we're finding testosterone in men, of course, unfortunately, is dropping really young in a man's life. And that's a huge problem because estrogen is so protective for women, brain, bones, heart, mood, skin. Testosterone is so helpful for men. And I'm seeing men in their 20s, men in their 30s with low testosterone, and they're starting to develop these quote old man symptoms, heart issues, brain fog issues, arthritis, joint issues, muscle loss, mood changes, all because of their testosterone. And it absolutely impacts their immune system.
Hey, if you guys know a man with these symptoms, or you know a man with autoimmune disease, tag him on this video right now because he needs to watch it. And I can tell you right now, we have men through our who've been through our program, and not one of them with autoimmune disease have a normal testosterone level.
I would believe you. I totally believe you. Yep.
This is a freaking epidemic and a shame that we're ignoring male hormones and dealing with autoimmunity, yet we're ready to pump them full of Humira and Embro.
Right. Exactly. Yeah. Exactly. Yeah,
I totally agree. And that's why for me, we test men. You have to test men and you got to educate men. And all the women that's in our program, they're educating their dudes about it.
Yeah, as they should, right? Like, absolutely.
I love it. We got more questions. Michelle Inks wants to know, what is the best diet to follow for hormone balance?
There is no best diet, unfortunately. What I tell people is definitely whatever diet you choose, you want to attack it with, like, make it plant-based. So make it lots of vegetables, get your good fiber, get your good fruits, get some good quality protein, get your healthy oils in there. And, again, everyone's different. I cannot be a carb-free person. I have tried keto. I've tried paleo, and man, does it make me an unfriendly person. And so I don't do it. Other people thrive. Other people totally thrive on a ketogenic diet or a paleo diet or autoimmune paleo or whatever it is. And so I know it sucks. I know it's not the answer people want to hear. But it depends on the person. And honestly, when somebody says to me, I think I want to try this, I'm like, do it right, do it all in, don't cheat. And then let's evaluate. And if it's not working, then we'll stop it.
I agree. There is no one diet that fits all. That's why for me, like a lot of times under our comments, people are like, why don't you just tell me the diet to be on? Damn it.
I know.
And for me, I'm like, this is a highly personalized program.
Yeah.
You alone have your data. You alone are going to get educated in a group setting, learning about how to implement this and what to remove, what to put in. The food intolerances in our food mapping process is a really key place to start, number one, because that in itself can be triggering your autoimmunity. But number two is blood sugar balance is huge, meaning that, like, high blood sugar. Somebody asked about a question about insulin. I think it was Rebecca asked about insulin. Like, what is the role of insulin as a hormone and blood sugar and insulin resistance and messing autoimmunity up?
Yeah. Oh, huge. I mean, whenever your blood sugar is messed up, I tell people, if you can't get your blood sugar dialed in, if you can't get it regulated, you will never fix your HPA, your hypothalamic pituitary adrenal, right? Your stress system. Cortisol's main job is to address your blood sugar. It's its main job. It's called a glucocorticosteroid for a reason. Glucose, it's a steroid hormone made out of the cortex of your adrenal glands. If you can't get your blood sugar dialed in, you will never fix your cortisol. And if you can't fix your cortisol, you will never fix your stress response, your immune system, your hormones, your sleep, any of that.
As Taylor Swift would say, never, ever, 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 never.
Exactly.
And that's why blood sugar is this huge part of our program. It's so interesting because people talk about these mandates. What's this test? What's this supplement? What's this diet? And man, blood sugar is like the biggest factor in affecting all these hormones.
Yeah,
absolutely.
These hormones. Yep. 100%. Between blood sugar and sleep, if people don't have their blood sugar or their sleep dialed in, it's a really, really, really steep uphill climb to get better.
Let's do a quick, because people are asking about liver detox food. Elizabeth's asking, Patricia's asking. Let's talk about, do a quick list. Let's go through a list of some foods that can help decrease estrogen dominance.
Oh, yeah. So we're looking, so like phase one, so that's again, the water coming into your bathtub. We're looking at like your cruciferous vegetables, your broccoli sprouts, your kale, your cauliflower, your mustard greens, those foods help there. Anything that helps the liver, we're looking at garlic, onions, artichoke, any of the dark leafy greens, all of your, oils, your healthy, cold pressed oils, really good, dandelion, all that stuff, really good for the liver. And then anything for the gut, we're looking at fiber. So I'm telling people, get your fiber up there, eat more vegetables. Right now at the time we're doing this, it's blueberry season. I'm like, get your berries, make sure they're organic, get your berries, get your fiber in there and really help get, your intestines moving to get your estrogen out. Now, people will say to me, can I just eat a whole lot of broccoli? Let's say, can I eat a lot of broccoli and That'll fix my detoxification. It helps, but no, unfortunately, research shows that you actually need significant amounts of broccoli for significant years to make the impact you would need from any kind of supplement. But when people say, what kind of diet do I switch to? I'm like, this is what you're going for. Go for the cruciferous veggies, go for the dark leafy greens, go for the liver-friendly foods, liver-friendly spices. So like turmeric, right? Curcumin, garlic, rosemary, those sort of things. Really good for cilantro, really good for the liver. So that's usually what I'm pointing people to. What about you? What are you adding in? What did I forget?
I mean, I love that. And for me, those are a lot of the foods that I focus on. But the thing is, I also tie it to, it's not just the foods, it's really the blood sugar piece.
Mm-hmm.
And personally, you know, like I really do love to juice, but that's not for everyone, especially people with really bad leaky gut issues or really intolerance to food issues. I do enjoy juicing to really stimulate a liver detox and a liver cleanse. Mm-hmm. And I love the fact that and the thing is, it's not just juice. I use the fiber, and I make a vegetable broth. Once a week, twice a week, I'll make a giant pot of vegetable broth just to sip on during the day. That has I juice cruciferous vegetables. Yeah. Mm-hmm. I mean, I love the ginger, the garlic, the ginger in there, not the garlic. I put cayenne pepper in there.
Yeah. Yep.
You know, this morning I had pineapple, kale, cilantro, and ginger juice.
Perfect. Yeah. Perfect.
And
simple.
The fiber I'm going to be putting into using for the soup, the broth. I make vegetarian broth all the time to just sip on during the day. It's wonderful.
Yeah.
You know? And it's interesting how, you know, I would say I eat largely I would say I go for the 70-80% plant-based diet, mm-hmm. you know, and I think that that's really helpful. But at the same time, it's really difficult, I think, that for pure vegetarians or vegans mm-hmm. to really get enough protein and fat for this whole blood sugar balance issue. And blood sugar balance is so key in autoimmunity that, you know, you absolutely can do it. It just takes a lot more education and work to do it. And you absolutely need data to be able to tailor it.
Right. No, I would agree. I would totally agree. Mm-hmm.
So we have questions from the group about contraception. People say, why not just get on the Mirena and the birth control pill and call it good?
Well, why not? Let's start with the Mirena, because I saw a Mirena question come in earlier. So the Mirena, or its sister Skylina, or what's the other one? There's a third one, Skylina, Mirena. Well, anyway, they're the progestin only birth IUD. And so what we have found, so if you read the package insert of the Mirena, it says right in there that it might partially or fully suppress ovulation. So when you partially or fully suppress ovulation, that means you partially or fully suppress progesterone production. Progesterone is our calming, soothing, relaxing, everything's going to be okay hormone, and it can then put us into estrogen dominance in relation to our lower progesterone, being on the Kylina, Mirena, Skyla, or Kylina. That's right. Of that IUD.
Sounds like Mean Girls, man.
I know, right? Don't they? That's a really good point. Yeah, Mirena, Skyla, and Kylina. Oh my gosh, it really does. We can make a movie. So yeah, so not all women experience this. Some women love the Mirena. It's no big issue. And a lot of women have these, they get the Mirena, and after a while, they're like, I have all these estrogen dominant type symptoms, or I'm having hair loss, or I have greasy hair, or my skin is breaking out, or I'm gaining weight, or I'm having back pain. I don't know what's going on. And we find that it's often the Mirena at play.
So that's an interesting question, because that's the thing is that for me, like, contraception is real. People need contraception.
100%. Not opposed to it. I just want women to know what the risks are.
Exactly. And you and I have talked about this. And I think for me, it's really important to talk to each person to figure out which fits that person the most, or their husband's the most. And that's the least hormonal thing that you can do to a woman, is actually have why am I forgetting the name? Male sterilization.
A vasectomy.
A vasectomy. Why am I forgetting that?
Get the snip. Yes, vasectomy
is actually the most. If you guys are really into need permanent contraception, that is the kindest, most generous thing and the thoughtful thing for a dude to do, is to prevent your wife from having to get into tons of these hormonal manipulation contraception techniques that can really mess up a lot of things.
Yep.
That being said, though, I mean, personally, I say that I don't think the Mirena or some of these progesterone necessary IUDs are necessarily all bad, because there's many benefits to it. And I have tested many women on the Mirena, their hormones, and I haven't seen it totally suppress their hormones. It does happen to some. It's
mainly progesterone, and working for a lab and seeing thousands of tests, this is how I know it. And we see And obviously, if you're doing hormone testing, you're probably out of balance. So I'm going to see the worst of the worst working for a hormone lab. But we see it enough. And that's why I pulled the package insert to see what the package insert said. And I was like, oh, sure enough, they say it right in there. It can partially or fully suppress. And the reason is people will get taught that the Mirena is local, or these IUDs are local. Like, oh, the hormone just stays in the uterus. It doesn't go anywhere. I'm like, really? Do you have a wall built around your uterus? Like, I'm pretty sure it's not local. I'm pretty sure it escapes, gets in the bloodstream, and can definitely go up to the brain. And that's how it affects ovulation. But like I said, tons of women use the Mirena and have no issue. Like, they don't have a problem at all. I'm talking to the women who, unfortunately, it doesn't work for them.
Yeah. And then birth control pills. Jolene Brighton just wrote the book Beyond the Pill.
Beyond the Pill. Yep.
Book. And, why not just put you on? I was put on birth control pills when I went into early menopause at age 36, and they called it good.
Yeah.
Why not? Why isn't that a great solution to balance your freaking hormones?
Because it's fake. So the birth control pill goes to the brain and tells the brain, stop communicating with the ovaries. So it does. It stops communicating. The ovaries don't make estrogen. They don't make progesterone. They let the birth control take over, which is fake. It's fake estrogen and fake progestin. And then you don't ovulate and you don't get pregnant. And I'm not against the birth control pill. I want women to realize, like, I'm all about your birth control options. I fully believe in them. But I want you to know the risks, and I want you to know that you don't just go on the pill and all is good. Like, there's a lot of side effects that can happen, as Jolene points out in her book, or when she gets interviewed and whatnot, that can happen with the birth control.
Those of you that are watching right now, any of this is striking a chord with you. You got teenage daughters that are on birth control pills. You yourself have PCOS, insulin resistance, hormone issues. Go ahead and put, people's names in the comment section so they can watch this video later. Yep. That'd be really helpful for them. We have some final questions coming in. Jessica Matthews is asking, what about DHEA versus DHEAS?
Oh my gosh.
What's the difference?
I love DHEA.
I know.
It's funny. So DHEA is made in your ovaries, and it's made in your adrenals. So let me back up. So DHEA is the active form. When you put a little S on there, the sulfate, DHEAS, you are no longer active. You cannot bind to receptors and do the things. You have to take the S off, and then that's DHEA that binds to receptors and does the things. So all of your DHEAS is made in your adrenals, and most of your DHEA. The rest of it's made in the ovaries. Men, you're the same. Your testes make some, your adrenals make most. So we get it from both places. Now, DHEA, believe it or not, is really protective. It's protective against cortisol in the brain. It's protective against brain damage. It increases something called brain-derived neurotrophic factor, so BDNF, good for the brain. It increases my favorite neurotransmitter, which is acetylcholine. That helps memory. It helps learning. It helps, it even helps muscles. It does really good things. Now, some women, though, have too much DHEA, and as a result, then they get acne. They get hair loss, or hair growth in places they don't want, hair loss on their head. They get angrier and irritated. And so it is, again, it's Goldilocks. It's a balance. But in particular, DHEA can go down the acne pathway, which is why I like Dutch testing or urine testing, because I can see how much DHEA do you make, and then where does it go? Like, is this the reason you have acne on your jawline or your neck or, wherever it is?
Yeah, people don't realize the adrenals is actually a huge part in making hormones, and that the hormones from the adrenals, like DHEA, converts into testosterone, which then breaks down into estrogen. This is a whole other pathway of connection. And a lot of times people just take a bunch of adrenal supplements and DHEA without testing, and actually can do a hell of a lot of harm.
A ton, which is why DHEA is controlled in other countries. DHEA is over the counter here in the United States, but in the UK and Australia, like it's a controlled hormone that you have to prescribe, like testosterone, for that reason.
Which is why testing is really important, and
always Because what happens is women will start, or men, they'll just start it, and then they'll get all the side effects, and they're like, this is bogus, this is crap, this doesn't work. I'm like, no, you didn't know, and you pushed yourself down the wrong pathway. Or maybe DHEA is not what you needed. You thought it was because you took a quiz online, but it's really not what you needed.
So here's the deal, Carrie. I think here's the moral of the story for people. You want to be testing your hormones with people who are like mad biochemistry scientists. Like myself and Carrie, because it's really important that people understand these pathways and where all these hormones are going. Because the problem is that you cannot depend on your conventional doctors to understand any of these pathways.
Right.
They just have no training. And I had no training in it. I had no training in autoimmunity even, right? And I had to learn all this on my own because my life sucked.
Yeah.
I happened to work with this great woman.
Aw.
You know, and so for me, it's like this, you literally changed my life.
Well, dang, Maggie, I'm gonna record that. That's like the greatest thing ever.
You did. And that's why for me, like, this has been such a pleasure to be able to like bring you to teach.
Like full circle.
Yes, it really is coming full circle. And I just want people to know out there, like, oh my gosh, there's so much scientific tools out there from naturopathic physicians, integrative physicians, and you can work with biochemistry nerds like us to actually teach you how to actually get your hormones tested, how they apply to your autoimmunity, and people get turnarounds like quick. I mean, how many people, alumni that are watching the program, please comment below. How has turning around your hormones and your adrenals totally affected your autoimmune disease? I mean, if you guys don't know anything about our program, please go to drmaggieyu.com right now. You can watch a free training about our program, and also in our Facebook group, which is Transform Autoimmune Disease Naturally. You go in there. I interview one alumni every week who's graduating out of our program to talk about their journey and their lessons and their takeaways.
Yeah, that's incredible. That's incredible. And it's your program is right there at their fingertips. Yeah. Right? They don't have to go anywhere. They don't have to drive anywhere. They don't have to get online and search to find a practitioner. They just
Carrie, but this belief, I mean, I want to bust that. I wish I could bust that myth that people think that one-on-one interaction with a provider is the way to solve these ginormous problems.
Right.
And you and I have worked one-on-one with people for 10, 20 years of my career.
Yep. I'm at 15, 16. Yeah. Yeah.
And one-on-one was really slow and laborious.
Yeah.
And it was not an educational platform. And it was not a group learning format. And
there's so much to teach. There's so much to empower somebody. And yet you don't want to come back all the time. You know, it's hard to be like, okay, I want you to come back next week. And I want you to come back next week or next month. And after a while, you're like, oh my gosh, really? My insurance doesn't cover this. It's like, hold on. Your group platform is such a better base for this, for people.
Yeah, please, guys, it's free. The Facebook group is Transform Autoimmune Disease Naturally. Just go ahead and search that in your Facebook search right now and join, and just click join and join the group. That'd be great. And tell us about you. We love to learn more about what's going on with your autoimmunity so we can actually point you to the right resources. Tons of free resources in the group for you to learn more on. So,
incredible.
Carrie, thank you.
Oh my God, Maggie, this has been fantastic. I love seeing your face.
Thank you for the reunion, and thank you for saving my life and educating me.
Oh my gosh. And thank you for all the opportunities you gave me. I mean, it was truly, like your name of your group, truly transformational. So.
All right, everybody, thank you so much. And give Carrie a big thumbs up and a big heart, and have a great night, everyone. And hop over to drmaggieyu.com to watch our free training on transforming your autoimmune disease naturally. Thanks, everyone.